Struggling with hair loss? Androgenic alopecia, or AGA, affects millions, causing progressive hair thinning and loss. But there's hope on the horizon with a game-changer in hair restoration: exosome therapy. Let's dive into this cutting-edge science. Exosomes are tiny nano-sized vesicles. Think of them as nature's delivery system. Ranging from 30 to 150 nanometers, these vesicles are packed with proteins, lipids, and nucleic acids. They're formed inside cells within multivesicular bodies and released to communicate with other cells, carrying powerful regenerative signals. Scientists identify exosomes by key markers like CD9, CD63, and TSG101. Advanced tools like electron microscopy and nanoparticle tracking analysis ensure we're working with pure, high-quality exosomes for therapy. Traditional treatments like minoxidil or finasteride can help, but they often fall short and come with side effects. Exosomes, however, are cell-free powerhouses, safe, potent, and designed for long-lasting results in treating AGA. So how do exosomes work their magic? Let's break it down into 5 key mechanisms. First, stem cell niche activation. Exosomes from mesenchymal stem cells kickstart hair follicle stem cells, pushing them from the resting telogen phase into the active anagen growth phase. Second, angiogenesis. Exosomes carry growth factors like VGF and FGF, boosting blood vessel growth to deliver vital nutrients to hair follicles, helping reverse miniaturization. Third, anti-inflammatory effects. Exosomes are loaded with microRNAs like MyR21 and MyR146A, which dial down inflammation and protect follicular cells from DHT-induced damage. Fourth, paracrine modulation. Exosomes act like messengers, enabling crosstalk between dermal papilla cells, keratinocytes, and the follicular niche, creating a rejuvenated environment for hair growth. Finally, signal transduction. Exosomes deliver powerful molecules like WNT10B, VGF, and FGF7, restoring the regenerative potential of weakened hair follicles as seen in advanced gene therapy models. Thanks to breakthroughs like T-Lab, autologous exosomes, or metacell technology, and manual ultracentrifugation, we're now able to isolate high-yield, high-quality exosomes, revolutionizing their use in clinical settings. Exosome therapy is transforming hair restoration, offering a safe and effective solution for androgenic alopecia. Clinical trials are showing promising results, bringing us closer to fuller, healthier hair. Ready to explore the future of hair restoration? Stay tuned for more on how exosome therapy is changing lives one follicle at a time. Thanks for watching, and here's to healthier hair with the power of exosomes. Made with input from Prof. Patrick Treacy, Aylesbury Clinics Dublin, and Dr. Prabhu Mishra, India Stem Cell and Regenerative Medicine.